Hello everyone. Today, we're diving into the world of a medication called Durvalumab, commonly known by its brand name, Imfinzi. As with all our discussions, this is meant for educational purposes. If you have health-related questions or concerns, always reach out to a medical professional. Description: Durvalumab, often recognized by its brand name Imfinzi, is a medication classified under immune checkpoint inhibitors. It works by targeting and inhibiting the PD-L1 protein, which allows the immune system to detect and attack cancer cells more effectively. Initially approved by the FDA in 2017, it's primarily used to treat specific types of cancer, including non-small cell lung cancer, NSCLC, and urothelial carcinoma, a type of bladder cancer. Specifically, Imfinzi is used for patients with locally advanced or metastatic urothelial carcinoma who have disease progression during or following platinum-containing chemotherapy, or within 12 months of neoadjuvant or adjuvant platinum-containing chemotherapy. It's also prescribed for the treatment of patients with unresectable, stage 3 non-small cell lung cancer, NSCLC, whose disease has not progressed following concurrent platinum-based chemotherapy and radiation therapy. Warnings: Durvalumab comes with its set of precautions. It's crucial to be aware that it can cause immune-mediated side effects, which are conditions where the immune system attacks normal organs and tissues in the body. These can affect various parts of the body, including the lungs, pneumonitis, liver, hepatitis, intestines, colitis, endocrine glands, hypophysitis, adrenal insufficiency, thyroid disorders, and type 1 diabetes mellitus, kidneys, nephritis, skin, severe rashes, and other organs. Immediate medical attention is necessary if any symptoms indicative of these side effects appear. Before taking this medicine. Before starting Durvalumab, several factors need consideration. It's essential to inform your healthcare provider if you have any immune system conditions, including Crohn's disease, ulcerative colitis, or lupus. Patients should also disclose if they have had an organ transplant, as Durvalumab might increase the risk of organ rejection. Pregnant or breastfeeding women should discuss potential risks with their healthcare provider, as Durvalumab can harm an unborn baby or nursing infant. Regular monitoring and communication with your healthcare provider are vital to managing any emerging side effects. You should not take Durvalumab if you have had a severe allergic reaction to Durvalumab or any of its components. You have active or history of pneumonitis. You have severe hepatic impairment. You have severe renal impairment. You have had a prior severe reaction to any monoclonal antibody. Before starting the medication, inform your doctor if you have any history of lung disease or breathing problems, liver or kidney problems, an autoimmune disorder, had an organ transplant or stem cell transplant, any infection, including viral, bacterial, or fungal infections, any history of inflammation in the colon, such as colitis or Crohn's disease. Side effects. All medications can have side effects, and Durvalumab is no exception. Some common side effects include fatigue, cough, shortness of breath, decreased appetite, upper respiratory tract infections, and rashes. More serious side effects require immediate medical attention. These can include symptoms of immune-mediated conditions such as new or worsening cough, chest pain, shortness of breath, severe abdominal pain, persistent diarrhea, yellowing of the skin or eyes, severe muscle weakness, and extreme tiredness. Additionally, hormonal changes can cause symptoms such as headaches, vision changes, rapid heartbeat, increased sweating, and changes in body weight. Interactions. Durvalumab might interact with other medications. It's of utmost importance to inform your doctor about all medications, supplements, and herbal products you're currently taking to avoid any adverse interactions. This includes over-the-counter medications and any recent or upcoming vaccinations. Dosage. Correct dosage is vital for the effectiveness of any medication. Always adhere to your doctor's recommendations when taking Durvalumab. Regular monitoring and periodic checkups can help ensure the drug's efficacy and safety. The recommended dose of Durvalumab for adults with NSCLC is 10 mg per kilogram administered as an intravenous infusion over 60 minutes every 2 weeks. For urothelial carcinoma, the dosage is 10 mg per kilogram every 2 weeks until disease progression or unacceptable toxicity. Always ensure you're taking the correct dose and never alter your dosage without consulting your healthcare provider. Avoid While on Durvalumab, it's advisable to stay vigilant for signs of infection or other adverse effects. Avoid receiving any live vaccines during treatment and without your healthcare provider's approval. Given the potential for fatigue and dizziness, it's wise to avoid driving or operating heavy machinery until you know how Durvalumab affects you. FAQ. Many wonder about the age restrictions for Durvalumab. Currently, its safety and effectiveness in individuals younger than 18 are not well established. It's always best to consult with a healthcare provider for any specific queries related to this medication. Closing. That wraps up our overview of Durvalumab. Remember, this information aims to educate and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for tuning in.